Good morning, everyone. Is it still morning? Thank you so much for allowing me to be here today. What I want to talk to you today about are resources and that involve the siblings and family and transfers of care. So, we know that siblings are impacted, those who have a brother or sister with Dravet or other rare epilepsies. And we have done, as Jenny mentioned, put together a lot of programs. We've done some research. Many of you have probably participated in that research and may have participated in actually putting together those programs. And it has been really well received, and we're really, really happy that this has had a positive impact. But the question that we keep getting asked from parents and from the foundations are, what about our adult siblings? We've put all these really great programs into place for our younger siblings, but they grow up, and your loved ones are aging. And so what happens when everybody is aging, and what happens, and how can we support the adult siblings? So we started talking about how in many cases, and it's not in all cases, and I also want to recognize that we know that every family doesn't have siblings. So you might have support, future support probably with an extended family or somebody else in your support circle. But what happens when you, as a primary caregiver, are no longer able to provide care for your loved one with Dravet? And so we started talking about that and talking about what we would need to do to support siblings. And we ask why this is important. The sibling relationship that you have is probably going to be the longest relationship you have in your life. It will probably outlive your parents. It'll outlive your all other relationships. And then for parents, this is a really, really challenging and complex process to navigate. And then when we talk about healthcare professionals, I know that you've all probably at least thought about transitioning if you haven't transitioned yet, but many adult care providers do not feel well equipped to take care of your children. So this is an interesting quote. We did a lot of background research on this project, and this one just kept coming up. One of the parents said, I think, oh my God, if something happens to me, he's screwed, referring to the sibling, because they didn't feel like that they had appropriate plans in place to provide that transfer of care from the primary caregiver to somebody else. So we started taking a look at this, and we did a bunch of background research because we thought, okay, well, we need to do more research, we need to figure out what the unmet needs are, and we had these big grand plans to do a new project. But in the process of doing the background research, what we found is we don't know everything, but we know enough. We know enough to know that these families need resources. And so rather than continuing to look at what the unmet need is, we know that there's an unmet need. Let's dive right into actually creating those resources. So that's what this project is about now. We are expanding the sibling project that we've been working on for 5 years, and we're expanding that into supporting adult siblings. So let's take a look at some of the things. So I think I just kind of went over that. So let me just skip on to the next slide. So I wanted to give you a little bit of background, a little bit of insight into some of that sort of preliminary research that we did. So, there's much fear that caregivers have when they think about what will happen to them, what will happen to their loved one if something happens to them. And for siblings who may be thinking about taking on that role of primary caregiver, we hear from them that, they know too much. They've seen their parents throughout their life take care of their brother or sister with Dravet, and they know how difficult it is, and they know how complex it is. And because of the fact that they know this, it makes them feel a little overwhelmed over what will happen and how they would be able to take on that care. And one of their top concerns that they expressed to us was not even necessarily as much taking on the care of being able to manage and coordinate the medical and other care, but it would be how to take that plan and incorporate it into their daily living. Because they may be making plans of their own, they may be making plans for families, or what have you, and how they would be able to actually implement the care that you're providing. When we looked at the parents and got their perspective, a lot of the times parents say that, you know, I don't have a plan yet, and they worry that if the plan isn't solid, that they won't be able to discuss it, or they won't be able to move forward or bring their siblings or other family members into that conversation. And that's because the uncertainty of the future kind of makes it impossible to make those plans, because you just don't know. So, you know, what they kind of talked about and did align on is that the plan, whatever the plan is, can be discussed, and it should be discussed, and it doesn't have to be solid. The plan is going to change as circumstances change. As your loved one with Dravet ages, that plan is going to change. And then again, express the difficult challenge of what will happen to my loved one with Dravet if something happens to me. Also, we talked about, again, the having discussions. So what we heard from parents is they don't know how to start this conversation. They want to know what would be helpful to the sibling. And again, you know, the entire plan doesn't need to be mapped out. For those of you who may be joining us after lunch, there's a long-term care planning workshop. We're actually going to have a little session there that's going to talk about how to start those conversations. And we have two wonderful adult siblings who are going to join us for that, who are going to kind of give their perspective and be available to answer your questions. So if you haven't planned that already and you are thinking about these things, I really encourage you to be part of that workshop, because I think it'll be very informative, and again, it'll allow you the opportunity to engage with adult siblings who can kind of answer questions and give you their perspective. So what do we want to do? We want to come up with resources for parents and siblings to navigate this challenge. And what we heard, I want to hop over here to siblings. So, you know, when I mentioned previously that kind of the siblings know too much because they've seen how, you know, throughout their life, how challenging that it may be able to be to provide care for their brother or sister with Dravet. One of the things that they said that they were most concerned about was supporting you all through the transition process. Because when they look at, and you know, they're very much aware that there's going to be a process at some point where their brother or sister is going to have to transition out of a pediatric care, a care team, and move on to the adult care team. And that is a very daunting and complex issue, as you all know. It takes years. It's not easy. And one of the things that the siblings asked us was, could you please provide resources and help our parents get through that transition? Because if we can get through that transition successfully before the possibility of them perhaps taking on the primary caregiver role, it would be so much less stressful, and it would really, really help them in that process. So they told us the easiest way for us to help them is to help you. So what are we talking about? First of all, I just want to acknowledge that this is a very daunting project. It's a huge undertaking, as I'm sure you know. There are a lot of resources that are out there, but the feedback that we are getting from families that there really isn't anything that's specific to the Dravet community or other rare epilepsy communities that is helpful, that really addresses a lot of the concerns that you'll have and a lot of the challenges that you have. So, you know, let me also tell you that we're in the very initial stages of planning this project. It's absolutely going to take a village. We're going to need all of you to do this. We're going to need your input. And so what I am sharing with you right now is kind of some preliminary ideas and preliminary information, things that we have been discussing as we build up to really kick off this project. So what we've done so far, we've done a lot of background research to kind of figure out where we are. What are the questions that we need to ask? We are working with, we have a collaboration team. We're collaborating with the Dravet Syndrome Foundation. We're collaborating with LGS Foundation. We have 3 adult neurologists who are helping us. We have healthcare professionals. We have adult siblings who are helping us. And we hope that every one of you will help us. Because as I said, it's absolutely going to take a village. So I just kind of want to share some sort of high level, what are we thinking? What have we been thinking to try to put something like this together? We definitely want to have something for long-term adult care planning. Any kind of resource that we put together, the intention is for it to be completed by the primary caregiver. So that was one of the bits of feedback that we had gotten from Sibling, is that when it comes to the long-term care planning, they don't want to be the ones who are actually creating that plan, right? It has to come from the primary caregivers. But you should talk to the siblings or other family members who may actually be involved in any kind of future transfer of care. But talk to them and maybe find out how involved do they want to be. You may have some siblings who will come back and say, I absolutely want to be involved in, all these different aspects. And you may have some that go, nope, this is not for me. Or they may have different stages of their life where they're more able to accept this information and to have those conversations. I think probably many of you probably have a care binder of some sort. And so we talked about having a more formalized care binder. It could have a checklist of things that could be considered when looking to transitioning your loved one with Dravet to adulthood. You could talk about medical care, adult care, day programs, work options, housing options, insurance options. There's guardianship. There are so many different aspects to think of during this process, and so being able to break this down into each section, each different category, with maybe forms and templates on and checklists and things like that to kind of help keep things organized. And we want to make sure that whatever it is that we create is something that's easy to use. Some of the parents said, you know what, this is great. I've got a binder. I've had a binder for 10 years, but guess what? I haven't updated it in 3 years because I don't have time to do it. So we want to keep those things in consideration as well, because if this is whatever we end up creating, if it's not easy to use, then it's probably not going to get used. And the hope is that we would have some kind of sort of an overall care binder, if you will. Maybe it's electronic, so that you're doing everything, through an app, or you're doing everything online, and then you can print everything out and physically put it in a binder if you like that, physical paper or what have you. We also talked about having a version of the binder that is the sibling version. So maybe it is not as complex, it doesn't have as much detail, and maybe it has more of a summary of the care. Maybe it has guidance on how to take this information, how to take this plan, and then implement it into their daily life. Because remember, that was one of their top concerns. This is great, you can provide all this information, we're going to have conversations, and we're going to be engaged about it, but how am I actually going to implement this into my daily life with wherever I am? So that'll be really important. And then one of the things that we talked about, I showed you that quote earlier that we had gotten from a parent, if something happens to me, my sibling, my son is screwed. If something were to happen, and something that was unanticipated, what we talked about having was a crisis plan. So you may have a long-term care plan for your loved one with Dravet. You may have a plan to address all the different needs, medical, financial, guardianship, insurance, all the needs that you have. But if you were to take that and give that to another person to then all of a sudden implement and take over that care, it would be very, very overwhelming. Remember, it took years to put all this information together, all these resources, and it would be very difficult to take that on. So what we talked about was a crisis plan where you would have some kind of a guide that says, okay, if something happens, these are the steps that have to happen immediately. These are the people you immediately need to contact. These are all the things, a checklist that you have to do. And then as time goes by, here are some things that maybe are not as time sensitive that you want to start, tackling. So we want to be really thoughtful about not only what the resources are, how it's organized, how it's presented, and then how it's ultimately used. And then again, in a sibling binder, maybe we have a section on, okay, here's how to use the binder, like a whole section on what to do, and here are the different steps, and here's how you implement this or implement that. And then we also talked about, what will happen once we put all this together. How are parents, again, the timing of trying to be able to update all this stuff and keep all these things updated and so forth, is that, do we need to consider different types of support that are outside the creation of these resources? Maybe it's a workshop where everybody brings all of their information and, it's an online or what have you, and we're completing it together, or we're kind of, as a community, kind of helping each other. Do we have tutorials? Anyway, there are a number of different ways that we want to think about providing follow-up support, because it won't be enough just to create these resources. We also need to provide, a way for parents to ask questions and so forth. So that's kind of the gist of the project. And again, I know this is very daunting, and I want to say that, we are not going to be able to tackle every issue. There are so many issues with this process. There are so many challenges. Another challenge being everything varies from state to state. All of your loved ones are going to age out at a different age, depending on the institution, depending on where you are, depending on what your rules are for Medicaid. Your insurance may have different age out rules. And so we're not going to be able to probably identify and provide, every single nuance of detail. But can we provide you with guidance on, okay, here's what you need to tackle. Here are some keywords that you need to use to search to find that information. Here's, some guidance on how you get there. So again, we're gonna do the best we can to make this as robust and helpful as possible. But again, we can't do this without you. We really need you to provide input. Now, I don't know if all of you have looked through your registration bags, but there was a packet in there that had some different cards for some different surveys and things, asking if you wanted to participate in them. There is a card in there, and let me see, yes. So if you see a card like this, so we did kick off a survey a couple of weeks ago, and what this survey is asking for, it's asking for information to help us guide how to create these resources. We want to get an idea of kind of demographics, how many healthcare professionals are on your loved one's healthcare team. How often do you see them? How many healthcare professionals have you lost access to that you probably still need to use? Asking questions about where you are in your process with medical. It breaks down the medical aspects, the financial aspects, the legal aspects. Have you made a plan with your sibling? It's going to ask you questions like this to help guide us on what it is that we need to, how we need to organize and how we need to create the resources. We already know we need to create the resources, but we need your guidance on how. So I think I'm going to stop there. If you get the code, if you haven't already taken, please do take this. It's available in English and Spanish. And I think I can stop there and answer any questions that you may have. Yeah. I will say I'm super excited. I can't. I really can't wait to really dive into this. Anyway, let's ask if they have questions. Yes.
Mine is more of a comment, but I think it's so important. And my husband and I are the oldest ones here, and our son is 41 years old, and we have gone through all the legal planning, and it's so important that when we pass, that our son does not inherit our money directly. Then he won't be eligible for Medicaid anymore. You're only allowed $2,000 in assets, and I believe that's a federal standard to be eligible for Medicaid. So when you pass, make sure your inheritance goes into a special needs trust.
I actually have heard that feedback. So what age was that you set that up, the Special Needs Trust?
Actually, back in 1990, he was only 10 years old, but we were aware at the time that that would be a problem.
And there's another sibling, so we had to balance between the two. So we used a trust, and the trust will distribute the Special Needs Trust and his sister. I don't know if
And
that...
she will be trustee.
Yeah. And what about guardianship?
We have another agency that can take over guardianship. We're very unique in our area. We have an agency called...
The ARC Tampa Bay.
No, I'm talking about Advocare.
Oh, so there, we have another one. And think about this in your own area. It's called Advocare. I'm on the board of that one too. And we have to, and you pay a lump sum, and Advocare will advocate for your child the rest of the child's life. So our son, Danny's in the group home, and we've set up, this all takes long-term planning. That's why we have these conferences, and we've set up the financial part of it, but Advocare will advocate for Danny the rest of his life when we go. So that's important too.
So that's amazing, and so those are the very kinds of things that we really need to hear from you all. So like if you have something like this that you know is working in your state, in your local area, as much as possible, we want to collect that information so that we can then share that out and include that in these resources. And again, we're not going to be able to include everything, but the more that we hear from you all, the more robust this is going to be and better able to support and help other families. So thank you for sharing that.
Let me know if there's any more questions also, but before I forget, because I forgot before I introduced you, that Erin wants any of the ambassadors to, not now, but when we're done, go over to the Bravo's room, it's probably for a picture, and meet by the podium. I forgot to tell you that before. So is there any other questions?
Hi, this is a huge undertaking, and I appreciate you doing it. Do you have any rough anticipated time frame for when resources would be available for parents?
That's a very good question, and the answer is no. But I will tell you that we are committed to move this forward as soon as we possibly can. We've already done, as I mentioned, all the preliminary sort of background research, and now this is the piece that's critical, launching this survey to get this information to help us move forward. But I know, like in the background, we've already started collecting information and trying to figure out how we're going to outline this. So while I would love to say it's going to be done by the end of the year or it's going to be done by first half 23, at this point, I have to wait and see what we're looking at because it is going to be quite a complex project.
Was somebody talking over here? I thought I heard somebody.
I wanted to share with you that this morning I was privileged to be in Scott Perry's meeting with several healthcare professionals to talk about adult care with some adult neurologists who are interested in learning. And I see there's my beautiful two panelists are in the room, in the house here, Janice Stanley and Colleen Penwell. And they wanted to learn about, what it's like for families to go through that and asking a lot of questions. And I actually had to miss the last bit of it because I had to run over here. But did you guys have any insights or about, like, specifically, have they expressed certain questions or asks of us as far as how we can best prepare, because we've let them know. And I will tell you that I've heard from some of the healthcare professionals that you guys are going to have to be the ones to drive this process. They're not going to be able to do it.
That we would really appreciate when you transition to adult care, that you let them know that, you know, you are transitioning, and so you don't arrive at their appointment with a binder this big and they have a 15-minute time slot for you. So they just, you know, want to make sure, because these people are very interested in Dravet syndrome and adult care, which was very encouraging. And so they really are there to support us in any way we can, but they're going to have a learning curve too. And so that was one of the big things.
I think that's a huge one. They also talked about just across the neurology field, specific to Dravet, to have some best practices for that transition and having some of these types of resources that they can access as well. And there was a lot of discussion about kind of the team approach. So, you know, there is this time where you're working with a pediatric neurologist, for example, and you're transitioning, you know, and it becomes a care team with the adult neurologist. One slide that Laurie put up, and I came in late, I don't know if you started your presentation with it, in the meeting with the neurologist, and I think this really got them. In the survey that was done, one of the questions was, what other specialists besides neurologists does your child work with? And did you show that here? I did. Okay, there were 30 different specialists that were listed. Of course, you know, it varies from child to child, but that really, I think, gave the neurologist pause, like, okay, wow, this is a loaded thing. So I think, and that's just the medical. Right. So just a couple things. So, and there will be a session this afternoon that I think I'd encourage folks to come to.
The other thing that we are going to do is, once we put these resources together, so again, this is going to be parent-driven, right? These are going to be resources for you guys. But once we have those resources together, we're going to go through it with our healthcare professionals and the people that are going to be on our collaboration team and say, okay, boom, boom, boom. Here are the touch points that you need to have in the process with healthcare professionals. And to have, you know, maybe tips on conversations, how to have those conversations, when to have those conversations. You know, maybe there'll be a form template for a letter that you share out with, you know, a certain specialist of those conversations. So, you know, while these resources will be for you, we will incorporate their perspective and make sure that we have the appropriate touch points in there so that communication is two-way. And it's not just you.
Just a really simple tip from Dr. Seth Keller, who spoke on adult transition earlier. And when asking a question about the length of time for an appointment, he said it's really important for you to share that you have a complex medical condition as you're coming in, so that the scheduler can schedule maybe a 40-minute visit as opposed to that 15-minute visit, and that kind of level sets that time frame for you so that you have more opportunity to have a discussion with that physician.
Anybody else?
Any other questions?
Okay.
Well, thank you so much. Thank you.